Welcome to Optimal Health and Vitality After 50. My name is Trisha O'Hara. If you're new to my channel, welcome. And if you're returning, thank you so much for coming back. So today, I would like to show you some exercises on how to improve lower back pain. So first, we have to understand that lower back pain a lot of times is it's the symptom, but the problem is actually other muscle groups. For example, your glutes. When the glutes are weak or aren't switched on, then it causes overcompensation in the lumbar spine and the lower back. Or if your hip flexors here or shorten and tighten, which happens very often with inactivity, or if you have a job where you're seated all day long, then the hip flexors shorten and tighten, pulling the pelvis into an anterior pelvic tilt like this, and then creating more stress in the lumbar spine. Also, hamstrings, the muscle on the back of your legs, if those are shortened and tightened, that will also change the angle of your pelvis and create more tension in the lower back. The lower back is having to compensate for all these other muscle groups that aren't doing their job. So what I'm going to show you is a few exercises to work the other muscle groups, and you should feel some relief by the time we finish. So, okay. The first exercise I'm going to show you is hamstring flexion extension. So it looks something like this. Now, if you're just a beginner and you have no flexibility or very little flexibility, or you're not working out, or you need to assist yourself, you can with the chair, okay? So the first exercise is hamstring flexion extension. I usually do it for time rather than reps, because a lot of times I work with groups or couples, and this way it allows them to go at their own pace. But for the sake of the video, I will just show you, and we will do, for example, 5 reps. Now, you need to go within your comfort range, okay, your range of motion, because for me, I'm hypermobile, so please do not try to match my range of motion. Also, don't do any of these exercises if it causes you pain. So I'm going to show you sort of like a baseline and then how you can progress from there. So the first one, hamstring flexion extension. Again, since you are going to be just balancing on one leg, and if you don't have any balance, it could be difficult for you. So you can have a chair to assist you. So the first one would look something like this: flexion, extension, flexion, extension. Now, again, I'm hypermobile, so don't match my range of motion. For you, it could just be flexion, extension. Okay, you want to keep the hamstring straight. So if it starts to buckle, then you need to stop. So again, go within your range of motion. If you're feeling any kind of pain, then you need to stop. So the first, let's do 5 on the right, 5 on the left. So again, if you need to assist yourself, you can hold on to a chair. Otherwise, you can just stand without assistance. Also, if you want to work on your balance, you have good balance, you can also do it like this without actually touching the floor. And it would look something like this. Okay, so let's go ahead and start. We'll do 5 on the right, 5 on the left. And go. Flexion, extension, flexion, extension. Okay, and switch. Now, it might feel, I generally with my clients, I'll do it 3 sets. So again, you go within your range of motion, but generally by the 3rd set, the hamstrings feel a lot looser, which makes sense, right? Because with repetition of anything, you're going to have more extensibility and flexibility. So, okay, let's go 5 on the left. So you're going to go flexion, extension, flexion, extension. Okay, so that's the first exercise. Why that's important, again, like I said, when the hamstrings are shortened and tightened, they alter the pelvis and put more stress on the lower back. So if we can lengthen and strengthen the hamstrings, that'll help for the overcompensation of the lower back muscles. Okay, so secondly, we're going to go into hip circles, because when the hips are really tight, that also restricts the movement in the lower back causing the muscles to overcompensate as well. So hip circles, you're going to want, again, if you need to assist yourself, you can hold on to a chair and you raise your leg. You come up into hip flexion, no higher than 90 degrees. You externally rotate and then come back down. So you go up, out, and rotate. If you think about it, if you've seen a skeleton before, the hip is a ball and socket joint. So if you think about it, it's always rotating, right? It's externally rotating and it's internally rotating. For example, when you get out of a car, you're externally rotating, right? And a lot of people don't work in that transverse plane, hence they have hip replacement or hip problems. So this, if we can loosen the hips, that will also help to decrease the tension on the lower back. Again, like I said earlier, the lower back is generally the symptom. It's not the problem. The problem is the hip flexor, is tight, hamstrings, is weak glutes that aren't switching on. All right. Okay. So again, you can assist yourself if you need to. If not, that's okay. So you're going to come up, externally rotate, and down around. Up, externally rotate, and come around. So again, just visualize the hip as a ball and socket. So just kind of rotating around in that socket, and you can alternate. Okay, so generally I alternate, externally rotate, up, out. And again, you can do however many is comfortable for you. You could start with, 5 on each side, 10 on each side, and repeat 3 times. Again, the more you do it, the more, the greater the benefit, right? So, okay, so that is the hip circles. Next, for improving lower back and also strengthening, is laying down in the prone position, which means on your stomach. And again, we're going to activate those glutes and hamstrings. Because again, remember, we want to strengthen the glutes and hamstrings, thus alleviating the tension on the lower back. So I'm relaxing the upper body. And if you have severe lower back pain, then you can just keep your feet on the ground and squeeze your glutes and relax. So I don't know if you can tell, but I'm squeezing the glutes. So you can hold it 5 seconds, 3 seconds. Again, go within your comfort range. Don't do anything if it is causing you pain. So I'm doing it for 5 seconds. Squeeze. 3, 2, 1. Relax. And squeeze. 5, 4, 3, 2, 1, and relax. And you can repeat that 3 times, 5 times, again, whatever is comfortable for you. Now, if that seems easy, you can raise your legs, okay? So again, upper body is relaxed. I'm squeezing those glutes. 5, 4, 3, 2, 1, and relax. Again, you can repeat that 3 times, 5 times, whatever is comfortable for you. Or you can do single leg. I know with my clients, some clients that when I start with them, they have lower back pain. They can do both legs, but they can't do single leg. Or they can do single leg and they can't do both legs. So whichever one of these versions works for you, that's the most important, okay? So the next one, again, you can just lift one leg. I'm engaging this glute. 5, 4, 3, 2, 1, and I'm going to switch. Squeezing this glute. 5, 4, 3, 2, 1, and switch. And you can repeat 3 times, 4 times, 5 times, whatever is convenient for you. So that is the leg raises in the prone position. Next, what is really good for strengthening the lower back without putting stress on your lower back is bridging. So you come down, okay, back is flat, feet under your knees. You're gonna lift your hips, but you're gonna maintain that neutral spine, because if I overly compensate, then I'm going to put too much stress in my spine, which I don't want to do. So you just want that nice neutral spine, pressing your belly button in, and I'm squeezing the glutes. 5, 4, 3, 2, 1, and relax. Now, again, go within your comfort range of the degree you hold the bridging, because I know for some of my clients, if they're really tight in the glutes, like glute med, TFL, they can't go all the way up because it causes too much tension here. So go within your comfort range. The most important is squeeze those glutes, draw that belly button in, and relax. Again, you can repeat that 3 to 5 times. You can also come up and do it on your heels. Okay, again, squeeze the glutes. 5, 4, 3, 2, 1, and relax. That is bridging. Now, if that gets really easy, you can decrease your base of stance by just doing it on one leg. And that's going to use a lot more stability, right? You're going to really have to stabilize that pelvis so that this hip isn't dropping. So you want the knees equal and the pelvis stabilized. And then you come down and then you can switch. Okay, that's more advanced. So that is the bridging. That's really good for improving lower back pain. And next is doing the posterior pelvic tilt, which basically, in our spine, we generally have a curvature in the lumbar spine. So what you want to do is you want to posterior pelvic tilt. So your spine is flat on the ground. Think of like someone pressing into your stomach, and you're going to hold that. That's going to take all the tension off the lumbar spine, and you're going to hold it. 5, 4, 3, 2, 1, and relax. And we'll do that again. 5, 4, 3, 2, 1, and relax. And again, you can repeat that 3 times, 5 times, whatever is comfortable for you. And last exercise I want to show you is a crunch, a partial crunch. I like to use the stability ball because it really helps to stabilize your, keep your lower back on the ground without putting any stress on it. But if you don't have I'll show you in a second, if you don't have a stability ball, you can do it without. So you want to put your hands behind your head, okay? And as I come up, I want to look up above my knees. Why? Because if I'm pulling on my neck and looking at my quads, then it creates a lot of stress on the cervical spine here, which we don't want. So you want to exhale as you come up and then slowly relax. Exhale, squeeze, so engage those abdominal muscles, and then lengthen and relax. And relax. So that is, and again, you go up to your range of motion. Perhaps for you, it might just be coming up this far. Engage and relax. Exhale, squeeze and relax to where you feel the abdominal muscles engaging. And again, if you don't have a stability ball, you can just do it like this. Again, I like to have the legs up 90 degrees because that helps to support the lower back. Because when you're down here, a lot of times people are like trying to hoist themselves up, and it puts a lot of stress on your lower back, which we don't want. So legs up. Again, I'm looking up above my knees. And slowly come down. And again, you can use your hands to support your neck. If you don't, you can reach out to the side, whatever is comfortable for you. So those are some ways that some exercises you can do to improve lower back pain. Again, lower back pain generally is the symptom, and so you want to strengthen all the other muscles, lengthen the hip flexors, strengthen the glutes, strengthen the hamstrings, strengthen the abdominals, and you should start feeling better from there. So I hope you found these exercises helpful. If you did, please leave me a comment below and let me know what you thought. And I really appreciate you coming to my channel. And if you did, like and subscribe. I truly appreciate it. I hope you guys go out, have an amazing day, and I will see you on the next video. Have a great day. Bye.